In the realm of gender transition, hormone therapy plays a crucial role in aligning an individual's physical characteristics with their identified gender. Masculinizing and feminizing hormone therapies are two distinct approaches that bring about transformative changes in individuals seeking to affirm their true selves. These therapeutic options provide a pathway towards greater congruence between an individual's internal identity and outer appearance. Masculinizing hormone therapy involves the administration of certain hormones, typically testosterone, to induce masculine secondary sexual characteristics in assigned female at birth (AFAB) individuals. On the other hand, feminizing hormone therapy utilizes estrogen and anti-androgens to foster feminine traits in assigned male at birth (AMAB) individuals. These therapies serve as vital tools for transgender individuals seeking to align their bodies more closely with their authentic identities. The importance of masculinizing and feminizing hormone therapies cannot be underestimated. They offer significant psychological relief by addressing dysphoria experienced by many transgender individuals. By promoting physical changes such as growth of facial hair or development of breasts or redistributing body fat according to one's desired gender presentation, these treatments can ultimately enhance self-confidence and improve overall well-being. Gaining a comprehensive understanding of the differences between masculinizing and feminizing hormone therapies is imperative for both those considering this path for themselves and healthcare professionals providing care for transgender patients. This video aims to guide you through this topic by exploring various aspects such as medication use, effects on physical appearance, potential risks and benefits associated with each type of therapy. Let us embark on this journey together as we delve into the intricacies surrounding hormonally-driven transformations within gender transitioning. When it comes to masculinizing hormone therapy, testosterone is the primary medication utilized. Testosterone is responsible for inducing a variety of physical changes, aligning one's body with their desired masculine appearance. One notable effect of testosterone therapy is facial hair growth, which can provide individuals with a more traditionally masculine aesthetic. Additionally, deepening of the voice often accompanies this treatment as vocal cords thicken due to hormonal changes. While masculinizing hormone therapy can be tremendously affirming for many individuals, it's important to consider potential side effects. Acne is a common occurrence during testosterone treatment due to increased oil production in the skin. Similarly, some may experience heightened body odor as sweat glands become more active under the influence of testosterone. It is crucial to note that there may also be an increased risk for cardiovascular issues associated with long-term use of these hormones. However, further research and monitoring are necessary to fully understand and manage these potential risks in transgender patients undergoing hormone therapy. Ultimately, choosing whether or not to pursue masculinizing hormone therapy should involve thorough discussions between individuals and their healthcare providers regarding both desired physical changes and potential risks associated with such treatments. Honoring personal preferences while prioritizing overall health remains paramount throughout this transformative journey. Medications commonly used in feminizing hormone therapy include estrogen and anti-androgens. Estrogen is at the heart of this treatment, promoting the development of feminine secondary sexual characteristics. It helps redistribute fat to areas like the hips, thighs, and breasts, resulting in a more feminine body shape. Anti-androgens are another essential component of feminizing hormone therapy as they block or decrease testosterone production in order to reduce masculine traits. One of the most desired effects of feminizing hormone therapy is breast development. Under the influence of estrogen, breast tissue begins to grow and develop over time. While individual results may vary, many individuals experience an increase in breast size that can range from modest enlargement to a full bust. Other physical changes that may occur with feminizing hormone therapy include a reduction in body hair growth. With decreased testosterone levels, facial hair often becomes less dense while growing at a slower rate. Body hair on other parts such as chest, back, and arms also tends to become finer and lighter. It's important to note that just like any medical treatment, there are potential side effects associated with feminizing hormones therapy. These can include an increased risk for blood clots due to estrogen's effect on clotting factors within the bloodstream. It's crucial for patients undergoing this type of treatment be monitored closely by healthcare providers who specialize in transgender care. In terms of sexual health, Some individuals may also experience reduced libido or changes in sexual function, though these reactions aren't universal among all treated persons. The benefits must be weighed against these possible risks, the aim being patient safety throughout their transition journey. Before initiating hormone therapy, it is important for individuals to undergo a psychological evaluation. This evaluation serves several purposes, including ensuring the individual is well informed about the potential effects of hormone therapy and has realistic expectations. It also helps in assessing mental health status and determining whether any additional support or counseling may be necessary. Psychological evaluations typically involve discussions about gender identity, dysphoria experiences, personal history, mental health concerns, and coping strategies. They are conducted by experienced mental health professionals who can provide guidance throughout the transition process. The purpose of these evaluations is not to gatekeep or invalidate someone's experience, but rather to ensure comprehensive care that considers both physical and emotional aspects. Hormone therapy requires a long-term commitment as it involves ongoing administration of hormones over an extended period. Once started on hormone therapy, individuals should anticipate regular checkups with healthcare providers to monitor their progress and adjust medication dosages if necessary. Monitoring involves measuring hormone levels through blood tests and assessing overall physical well-being. Regular follow-up appointments help identify any potential side effects or complications early on so that appropriate interventions can be implemented promptly. It is crucial for individuals considering hormone therapy to understand that this journey entails lifelong hormonal management and medical supervision. Open communication with healthcare professionals regarding concerns or questions about the treatment plan will contribute significantly to its success while prioritizing safety and efficacy at all times. Both masculinizing and feminizing hormone therapies come with their own set of risks and benefits, which can vary in terms of their short-term and long-term implications. In the short term, hormone therapy can lead to noticeable physical changes such as voice deepening or breast development. These immediate changes can provide individuals with gender dysphoria a sense of relief and align more closely with their gender identity. However, it is crucial to consider the long-term effects as well. Masculinizing hormone therapy may increase the risk of cardiovascular issues such as high blood pressure or cholesterol levels over time. Additionally, there may be concerns about fertility preservation for transgender individuals who wish to have biological children in the future. On the other hand, feminizing hormone therapy might result in decreased bone density or an increased risk of blood clots. While both types of hormone therapies primarily aim to induce physiological changes that align with an individual's affirmed gender identity, they also have significant influences on emotional well-being. For many transgender individuals, undergoing these treatments allows them to feel more at ease within themselves by alleviating some aspects of gender dysphoria. Masculinizing hormone therapy often brings immense relief and euphoria as transmasculine individuals see desired body hair growth or muscle development. Similarly, feminizing hormone therapy has been known to enhance self-confidence among transfeminine individuals by facilitating breast growth or softening skin texture. However, psychological ramifications should not be overlooked either. Transitioning not only involves physical transformations but also profound societal and personal adjustments that impact mental health differently for everyone. It is vital that anyone considering hormonal intervention discusses potential emotional side effects like mood swings or depression with healthcare providers who specialize in transgender care. Overall, understanding both short-term versus long-term consequences and recognizing how physical modifications go hand in hand with emotional well-being is crucial for making informed decisions about hormone therapy. It is imperative to have ongoing support from medical professionals experienced in transgender healthcare to navigate these effects and ensure the best possible outcomes for each individual's unique journey. When considering hormone therapy for gender transition, it is crucial to have a clear understanding of one's personal goals and expectations. Masculinizing hormone therapy aims to promote the development of masculine secondary sexual characteristics such as increased muscle mass, body hair growth, deepening of the voice, and possible clitoral enlargement. On the other hand, feminizing hormone therapy focuses on achieving feminine secondary sexual characteristics like breast development, redistribution of fat towards hips and thighs, decreased body hair growth, softer skin texture, and potential male fertility preservation. It is vital for individuals to reflect on their desired physical changes and align them with the effects that each form of hormone therapy can provide. Open communication with healthcare providers regarding realistic expectations will enable an informed decision-making process. Another important consideration when choosing between masculinizing or feminizing hormone therapies is how it may affect fertility. For transgender men seeking masculinization through testosterone treatment, irreversible sterility is likely to occur after several months due to suppression of ovarian function. It is essential for those who desire biological children in the future to explore options such as freezing eggs before starting hormone therapy. In contrast, feminizing hormone therapy does not typically lead to permanent infertility but may reduce sperm production in transgender women taking estrogen-based medications. Nevertheless, there are currently no guarantees regarding reproductive capabilities during or post-transition. Thus, discussions with healthcare providers about preserving fertility prior to initiating any hormonal treatments should be considered if parenthood becomes a priority at some point in life. By carefully considering individual goals and being aware of potential impacts on fertility beforehand can help individuals make well-informed decisions about which path best suits their wishes while recognizing any limitations in terms of family planning possibilities down the line. In summary, masculinizing hormone therapy is typically used by individuals assigned female at birth who are seeking a gender transition to male. This therapy involves the use of testosterone, either through injections or topical applications, to induce masculine physical changes. These changes may include facial hair growth, voice deepening, increased muscle mass, and redistribution of body fat. Feminizing hormone therapy, on the other hand, is usually used by individuals assigned male at birth who desire a gender transition to female. Estrogen and anti-androgens are commonly prescribed for feminization. The goal here is to promote feminine characteristics such as breast development, decreased body hair growth, softer skin texture, and possibly slight changes in fat distribution. The importance of informed decision-making. When it comes to undergoing hormone therapy for gender transition purposes, whether masculinizing or feminizing, it is vital that individuals make informed decisions based on accurate information and guidance from healthcare professionals experienced in transgender care. Each person's journey will differ depending on their specific goals and overall health considerations. It's crucial for those contemplating hormone therapy to have conversations with knowledgeable experts who can explain the potential effects as well as any risks associated with these treatments. Ultimately, understanding the key differences between masculinizing and feminizing hormone therapies empowers individuals with knowledge that can assist them in making informed decisions about their bodies and personal identities. By being able to weigh the benefits against potential risks within individual contexts sensitively supported by healthcare providers specialized in transgender care becomes possible done so safely. Improving accessibility while maintaining accuracy serves not only those considering transitioning but all stakeholders involved, contributing towards better patient outcomes, ensuring personalized approaches while respecting autonomous choice throughout someone's transforming journey.